We're joined today by Professor Henrik Zetterberg.
Thanks a lot. Thanks for that introduction also. So I will give you a little bit of an update now on the blood-based biomarkers for Alzheimer's disease and related neurodegenerative diseases. So if I would start to conclude here now, because we're approaching the 30 minutes here, the plasma phospho-tau tests, most of them are ready for cautious clinical implementation. I really think that so. Plasma phospho-tau reflects both amyloid and tau. And the way we look at these biomarkers now from the different results that have been produced in a large number of cohorts now, it looks like plasma phospho-tau starts to increase relatively immediately when amyloid starts to deposit in the brain. And this probably represents a neuronal reaction to the amyloid plaque pathology. So neurons exposed to plaques will phosphorylate and secrete tau, potentially as part of a pruning induction.
Thank you very much, Henrik. That was a wonderful overview. I really appreciate the insights that you've shared with us. Does anyone have any questions? I didn't see any hands. I'll maybe start with one myself. So you were just talking about the relative strength of Aβ42 to 40 compared to p-tau in terms of ethnic and demographic factors. Could you comment on the situation for NFL?
Oh yeah, so NFL also has this problem with NFL it's such a I must say it's almost my favorite biomarker, but it has so many problems as well. So NFL increases in response to any neurodegenerative disease and any axonal injury event. So and that's I think that is good. And when we developed the first plasma NFL assay, the dream from our side was that this could be a readily accessible blood test that one could do whenever there was a suspicion on any brain process that would injure axons. I was thinking
before that, I was reading, Henrik, a little bit about NFL, and that there seems to be some accumulated evidence that there's a kind of NFL signal related to inflammatory events, neuroinflammatory events, as if you like, as well as neurodegenerative events. And I know that in some ways, if you could argue it's hard to discriminate them. But is there a sense in which one of those is a greater component or contributor to the signal than others, or any way to differentiate? What do you think?
Yeah, this hypothesis has been generated in the multiple sclerosis field for very good reasons, because so NFL really started to prove useful in multiple sclerosis, and especially in relapsing remitting MS patients, where there was a clear increase in people who had a bout of MS, and then when they were treated and got out of the bout, then NFL levels decreased again, and that was really seen quite convincingly in many studies. Then in neurodegenerative MS, and we don't understand this completely. But I would still argue that most data suggest that I wouldn't call NFL an inflammation biomarker, because then I think one should measure the classical inflammatory biomarkers and also astrocytic and microglial proteins. I still think it mostly reflects axonal injury, but perhaps in secondary progressive MS,